You want to tell the folks on the call a little bit about the coalition?
All right, so the coalition is made up of a lot of different groups from around the state of North Carolina. We got Action NC, a Mexican Center for Justice and Reconciliation, UE 150. As you can see, all of the different groups on this slide. Some of us been advocating for a universal healthcare system since the 1930s, and the other ones are new. So new and old alike have come together and are advocating for Medicare for all universal healthcare system.
Awesome. So what do we believe in? We believe that healthcare is a basic human right and that the United States must provide with due urgency all its residents with high quality healthcare. We envision a healthcare system that is publicly financed and privately delivered, a system that eliminates health disparities, effectively controls costs, and assures that everyone receives affordable, high quality healthcare.
All right, so what do? We are building a movement of individuals and organizations to promote and advocate for expanded and improved Medicare for all using these tactics, informing the public about the medical, financial, and societal benefits of expanded and improved Medicare for all, and mobilizing them to take action, educating, and working with legislators and community leaders to develop strategies for achieving the passage of expanded and improved Medicare for all, and working with organizations throughout North Carolina and the nation to mobilize support for expanded and improved Medicare for all.
Thanks. So why we need improved and expanded Medicare for all? There's so many reasons, but we decided to sort of try and put it a little bit in the context of COVID-19 and of course and beyond, and just sort of pose a few questions to really make us think about how absolutely crazy our healthcare system is. So first question, how reliable is employer-based insurance when millions are laid off during a public health crisis? We are seeing so many people lose their employer-based insurance. The tying insurance to employment is crazy anyway, because it really gives your bosses, the people over you, a lot of control over your life. It actually leaves you with very little choice, and it sometimes sort of traps you in a job that you might not like. So there were lots of problems before that we were always trying to point out, but unfortunately this COVID-19 pandemic has really brought the problems with employer-based insurance to the forefront. Want to do the next one? Or I can. How can a country contain a pandemic when 87 million and rising people are either uninsured or underinsured? Again, we're only as secure as the least insured amongst us, as we're seeing with this contagious virus that's going around. And it is not a good situation. And again, with all the people that have lost work now, even more people are now uninsured than ever before.
All right, how do deductibles and copays and other out-of-pocket costs people to delay and avoid needed healthcare? We can see right now with this pandemic, and even before, where people would refuse to go to the hospital because they would take them out of work, or they'll be facing a huge deductible or huge out-of-pocket expense. These are travesties that most industrialized countries do not face, and we as the richest country in the world should not have to face those.
Absolutely. So how does the fear of medical debt impact people's decision to seek needed treatment? Same thing, but just a different way of looking at it. People are afraid of debt. There was a study that showed like 43% of people were more afraid of paying for health care or going to the doctor for an illness than actually getting sick. That is a dysfunctional system. We have a GoFundMe healthcare system where we have a system where people have to beg strangers for money to pay for necessary medical debt, medical care, and it's just not right.
All right, why weren't we better prepared for this pandemic, given that we spend about twice per capita what other countries pay for healthcare? It's simple because the insurance companies are crooks, and crooks really aren't down to help you whenever it's emergency involved. They just round the profit off of you in those chances. We see that by by insurance companies, medical insurance companies profiting during this crisis more than they have been.
Absolutely.
Yeah,